channel to contact him. Okay? And after that, we managed to integrate third-party platforms in order to include more specialties to telemedicine. And the last one is that we developed virtual waiting rooms where the customers receive relevant information, or, for example, if the patient needs an initial evaluation, such as body temperature, or, for example, measuring the blood pressure before taking the appointment with the doctor.
Yeah, it's an actual waiting room, but it's a virtual waiting room. Okay, it happens on your screen. So, Internet of Things for medicine. So, Juan, you are the technical guy here.
On Internet of Things at Intico, we always seek to be at the forefront of the advances technologies of the So we include the concept IoT of medicine. So IoT stands for Internet of Things, and with that we're able to gather real-time data, then turn that data into information, and that information be displayed at a CRM.
Correct. A CRM that takes the 360-degree approach that we had before. So it shows a dashboard on the agent that is taking the call, for example, for him to address the patient needs. It can show a different dashboard for the executive of the doctor in charge, depending on the stage the patient is right there, right?
So that dashboard is based on indicators, and it is very important to set good and reliable indicators in order to perform a better customer experience, right?
Correct. And this,
so let's check this.
This is almost our final slide, and this is what is next, okay? It is what we call a virtual video bot, and although it looks like a regular Zoom call, those are actually not real people. Those are robots that will be able to help you on a video call if you request it. Some people feel more comfortable talking to somebody that just over the phone, and they can use, or they will be able to use, or robots as virtual assistants, in which the robot is going to be explaining on how to use a device, or how to fill a form, or whatever is requested at that time.
On our quest to improve the customer experience, we believe that a simulated human will give to the patient as a feeling of security or care from their medical provider.
Yeah, and this has been under development for the last few months. We are going to be launching this in the next 30 days. And so it's going to be available, let's say, almost now. Okay, so that was our presentation. Just one clarification: when we talk about collections, we mentioned very quickly collections in one of the slides. We're currently working with a company in Florida that they provide devices for you to monitor your health at home. So depending on the patient request and the doctor's indication, they deliver to your house the device that you need. So in collections and in those type of activities, the regulations are very clear, and we cannot use bots, not even video bots or call bots, to call the patients out of the blue and saying that you need to pay your invoice or here's your device. We need a consent from the patient before that, okay? We know that we work with the standards of the industry, and we are working now in getting the consent of the patients of that company to move ahead and implement the video and the chat bots, okay? So that's it. I think we are minutes earlier, and we are going to be here 3 days. We have a table in the main ballroom where we having breakfast, and we invite you to come. Many of you had contacted me before on LinkedIn or by email, so we'll be glad to take your questions here if you want to right now. We still have a few minutes. If you have more technical questions, Juan is the guy in charge, and we can have a coffee, and I invite you to come to our booth and have a conversation on how we can be of help for you. Okay, thank you very much.
Thank you.
I don't know if there's any questions here before leaving the stage. Nope.
Yeah. How do you know what you built is actually improving?
How do you know what?
How do you know what you have built is actually improving?
Well, it is based on customers' feedback. It is based on customers' feedback. It is not that we say that we are improving. We are constantly requesting customers or patients, in this case, feedback. And we have done that for many years, especially in the finance industry. And the customers receive quick surveys to give us the feedback if it is better or if it is worse than before. And so about if we are doing it right, that's what you mean? If we're improving ourselves? Yeah.
Every time you make a product, making a product makes things better, right?
Not always, but the patients are the ones to qualify, not us.
We don't take like a quantity of an indicator, like a quantity of how much we are improving. We base that on like in quality, qualitative, right? So for example, if you remember at the beginning, I told you that we start with only agenda implementation. After that, we receive feedback from our customers that they need more. That they don't need only just agenda implementation. That's why, I'm sorry. Where is the laser? Here. That's why we move forward to implement an artificial intelligence for omnichannel. So these 4 steps is like we first start with the agenda, then we move forward to omnichannel, then to the third-party platform integration. So all these steps is based on our feedback. So as I said, it's more like a qualitative indicator, right?
There's a government institution in South America that public health centers have an issue with the scheduling the appointments and trying to take care with a regular and traditional call center of the patient's demands. So we improved that in about 300%, the ability to contact the customer's base or the patient's base. And it was a huge improvement, and it was based on real statistics. I mean, they were not able simply to address all the demands. People coming back and forth, and so the contact centers are usually overwhelmed with that. So bots are precisely developed for that reason. Okay, they can manage hundreds of calls simultaneously.
Yeah, we have another question here.
Yeah, I think. Yes.
Your co-payments are deductible. Your platform, does it collect it from the patients or collect it from CMS, like Medicare, Medicaid, and private insurance?
It's both, and it is not that we have a solution that you have to adapt to. It is the opposite. Our solution adapts to what you currently have and improves what you have. So we adapt to the system that your institution is currently using and propose improvements. But we don't have a package that we send you. It's actually the opposite. We adapt to what you have and use AI for that. Okay? I think we have one last question. No, you're welcome.
On the initial intake call between the bot and the healthcare provider, can you give us some deeper insight on how that was executed as far as performance, time, standards, et cetera? How does the healthcare provider know that this is coming through the bot? The patient is already waiting to receive more information. What's the timing of that? So what's that blending between the bot and the healthcare provider as far as that virtual call, real call?
It's all integrated in the current systems that the healthcare has already. So most of the institutions already, they have their own contact centers. So we integrate with that contact center. So we use the live agents that are trained. The live agents are live agents of that contact, or your contact center, let's say. So we train them, and they interact with the bot.
Yeah, that's my question. What's the alert for the provider to understand that this call is coming through this?
Oh, they know. They have a screen. They know what is happening. Yes, they know exactly what is happening. There is a call in the waiting list, and there is coming, and there is a bot.
So there's a way to differentiate for that provider, right?
Yeah.
On that call center to know
Yes.
it's coming through the bot versus just a call coming
Yes.
from the patient outside of your solution.
The important thing there is that for the patient, it is seamless.
That's my question.
Yeah, no, for the patient doesn't notice that. Okay, so thank you again. We wait for you on the table. We're going to be there today and tomorrow. Well, 3 days actually. So thank you very much.
Thank you.